Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by my very, very amazing co-host.
Very amazing.
Sensory aware, Dr. Yes. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how are you doing today?
Doing pretty good. How are you doing?
I'm good.
Good. What's our topic today, Amy?
Well, before we get into our topic, I just want to make sure that everyone who is listening to this knows they can also watch us on YouTube at Jason Martin MD. You can find all of our social media handles here. And if at any point during this podcast you would like to jump ahead to a specific chapter, you can find the chapters in the description box below, along with the link to how to find a board-certified plastic surgeon near you, which is always my advice. You can also leave us a voicemail or send me a text at 303-630-9038.
Now that she checks it.
Now that that's all out of the way. See, they wouldn't know that if they were not longtime listeners. They'll just think you're mean. So, Dr. Martin, yesterday you did a rhinoplasty, and today we are talking about rhinoplasty. This is going to be a two-parter. First part, everything you need to know about rhinoplasty or nose jobs. We're going to cover the statistics, how to choose a surgeon, basics of who's a candidate. And then in part two, we're going to go over the really in-depth anatomy, the pre and post-op appointments, your recovery, the actual details of the surgery. So this is your starter. This is your pre-consultation consultation for rhinoplasty.
Rhinoplasty, one of my favorite surgeries. We love this surgery, pretty amazing outcomes. And the fact that we have two parts is going to be awesome for people considering this procedure.
It is. Well, we do have an old episode about rhinoplasty, and a couple, but I feel like it's been at least 4 or 5 years since we've talked about rhinoplasty specifically. Because what is time?
I feel like it was around the time of COVID that we did it.
Yeah. So a long time ago. So this will be fun. The first thing we always start talking about with these procedural podcast episodes is the statistics, because everyone's trying to trick me up with these challenging words. So in 2020, which is still the year that we are referencing, even though we're in 2024, the board has yet to get us up to date with newer stats. They are slipping. Rhinoplasty, there were a lot. In 2020, there were over 350,000, which was just a 3% change from the year prior, which if anyone remembers the difference between 2019 and 2020, you'll see why that is so significant.
Yeah.
Also, over 20 years, it's only changed 9%, which is even more remarkable because a lot of the procedures we do, the change is much greater, just because there are more people having surgery. But this one has stayed pretty stable. Breakdown between men and women. This is a female-dominant procedure. And again, this is with board-certified plastic surgeons. This doesn't take into account ENTs or facial plastics because those are different boards. So this is just from our board. Was about 288,000 female and 65,000 men. So that's kind of how it breaks down male to female. Ages, the most popular ages for this are going to be your young and your middle-aged, not so much your 55 and over.
I don't think I've ever done rhinoplasty in someone over 70. I can't remember doing someone over 70.
No, I can't think of anyone
besides
either.
Trauma, some traumatic injury, but like congenital.
But a cosmetic rhinoplasty? No.
That would
Even
be pretty awesome. That would be fun to do, actually.
Yeah. And we do talk about this in our old episodes about rhinoplasty, about how the nose anatomy does kind of like stretch as you age. So this is why you see that there's a lot of rhinoplasties done on the 20 to 29. That is the highest category with well over 110,000.
But then you get the 40 to 50 range too.
Well, and it stays pretty stable. I mean, look at the 30 to 39 is still 84,000 and 40 to 54 is still 78,000. So this becomes an extremely popular procedure, even starting in adolescence, going all the way into the 50s. Mm-hmm. And then it precipitously drops off. 70 and over was only 4,700.
I think you have two peaks to the curve, young and middle-aged. Mm-hmm. That's kind of what we see in our office.
Well, I think it's the ones that are congenital. And then when people have the money, perhaps, once they become like they're done paying off their student loans, they still want a rhinoplasty. They've hated it since they were 20 and now they're 40.
They've gone to Bora Bora. They've done everything they wanted to do.
Their kids are in college.
Now they're going to do their rhinoplasty.
Oh, this makes me think we need to do a myth-busting episode about rhinoplasty.
Yeah.
All right. So rhinoplasty can do what? Rhinoplasty can balance the nose for facial harmony.
Which I think, by the way, is a big part of a rhinoplasty. Mm-hmm. People always think of rhinoplasties in a bad way, bad connotation, stuff you see on the internet, stuff you see in magazines and movies and stuff like that. But a good rhinoplasty balances out the nose itself and also balances it out with your face too. So it's about creating balance for your face and the nose itself.
Yeah. The more kind of fine-tuning parts, we can narrow the bridge.
Which we do all the time, did yesterday. Yep. A lot of people have bridges that are pretty wide. You can narrow those down.
Yep. Adjust and reduce the size and the position of the nostrils.
Which is called a weir excision. Amy loves all of our medical medical words.
What's that water rabbit? Emma Ford.
Yeah, so weird.
You love those rabbits.
Yeah, so you can make her nostrils a little bit smaller and repositioned.
Yep, improve the profile. I think that's the thing that most people think about.
Yeah, you always think about the bump. Like people always come in like, I hate the way I look from the side in pictures.
Can we get Nils? Give her back her old nose.
Oh, of course.
Oh yeah,
Spaceballs. Reduce the hump.
Where did you get that?
And in line with that Spaceballs reference, refining the nasal tip.
Which is a big part of it.
Yes, because it can be enlarged, bulbous, drooping, upturned, or hooked. You see that, who's the famous person that everyone thinks is quirky looking, attractive that I just...
the brother.
Yeah.
Owen Wilson.
Owen Wilson. Yeah. He's got a weird tip. It's bifid. It's hooked,
crooked.
It's drooping.
Yeah. We should, that's not our MO, but that would be fun to do a whole episode about his nose.
There'd be a lot to talk about.
Yeah.
He has all these things.
It seems to get weirder as he gets older,
Oh,
too.
yeah.
It does.
It doesn't get any better.
They get weird.
He went through a tough time. I'm not sure what happened. I think he had some issues, and I just saw him in a recent movie, and it looks worse.
Yeah.
Really? Yeah. Wow. And then, Dr. Moore, I'll let you talk about the last one.
The symmetry. So a lot of times, noses are not perfectly symmetrical in terms of taking it down the midline and looking from right to left. It could be crooked. You could have bony prominence on one side and not the other. So...
Well, we've had patients who've had one nostril that was very, like, they were like twins separated at birth. Like, they were not even close
different
to the
nostrils.
same.
There's so many different things can occur. The tip can be asymmetric. So symmetry is a big part of it. Rhinoplasties are about, in some ways, reduction, but they're also about addition, depending on what your kind of problem you have. And it's about using really smart techniques to bring back balance and symmetry to your nose in comparison to your face. Obviously, a large bump on your profile, and you have nothing that really supports that from a facial symmetry standpoint, taking down that profile into what we consider a normal profile is truly transformative. It's a simple procedure just like that. So these surgeries, even though they're small and delicate and nuanced, can be hugely transformative.
Yeah, they are. They're a surgery of millimeters for sure. Even in a drastic case, there's still tiny, tiny adjustments.
I wanted to throw in that we did a Your Perfect Rhinoplasty episode about a year ago.
Seriously?
So we do have a kind of a high overview of it. But then before that, it was 3 years ago, Rhinoplasty 2.0. So that was
I feel like we're going back
more than 3 years ago.
Yeah.
So you were right. That's a long time
That was
since
a
we've
long
done
time.
one. Yeah.
Yeah, thank you. I'm sure Nils will link those episodes in the description box below.
Actually, we're going to click on this
Your Perfect
one, right?
Rhinoplasty.
There you go.
Yes. So now we know what rhinoplasty
We got 3 more.
can do. There's 2 major things that rhinoplasty cannot do. And the first one, as we say with a lot of surgeries, or all surgeries, is no surgery is going to stop the aging process. The rest of your face will continue to age, and your nose may have normal age-related changes with time.
So the ligaments in your nose, the soft tissue ligaments, as Amy was talking about, get looser, and your nose can dip or like kind of start to sink and go down.
Tip can start to droop.
Your skin can change with UV and UVA and B related changes or sun exposure. Your nose can look bigger for a lot of different reasons, and you can have worsening deviation of your septum, so asymmetry of your nose.
Well, and just the overall, we talk so much about symmetry with this surgery that your facial harmony can kind of start to change as you age too. So a nose that may have fit your face when you had like nice chubby cherubic baby fat cheeks, as you age into your 4th and 5th decade and you start to have a little bit thinner, more gaunt face, now your nose might look big.
Right.
Or maybe you've broken it a couple of times and now it needs to be fixed. So.
I was showing a patient something on my face, like how you lift things for a facelift.
You stopped doing that, right?
Right. And then I caught a glimpse of my nose. I'm like, oh my gosh, what's going on there?
You have a perfect nose. It's perfect.
Not really. It was bad lighting. It was bad lighting. I was a little bit taken back.
Well, if you were at the hospital, the lighting is really bad there. The other thing that a cosmetic rhinoplasty is not meant to address is breathing problems.
Yeah.
Now, though it can be done in conjunction with it, but the rhinoplasty itself is separate from addressing breathing concerns.
Plastic surgeons do breathing surgery, which would be septoplasty, and turbinates, which are these outcroppings in your nasal airways.
Kind of like air conditioners for your nose or humidifiers.
Humidifiers, yeah, that's probably a better way to put it. But yeah, a swamp cooler. But sometimes they don't. And ENT surgeons tend to do the more airway surgeries, and sometimes they don't do the cosmetic rhinoplasties. Every now and then you get someone who does both. I don't have a problem either way. I think it's nice to go to a primary airway surgeon because I think there's some nuance there too.
Well, then they can follow you too for if you have sleep apnea or other issues related to breathing. And that could potentially be covered by insurance, whereas a cosmetic rhinoplasty will never be covered by insurance.
Right. In our office, for example, we tend to operate concomitantly with the airway surgeons because I think it's just better for the patient. But I'm capable of doing the septoplasties and turbinates.
Well, yeah, we do facial trauma reconstruction like you are, but not every surgeon is.
I think sometimes there's little nuances there with airway surgery. I think you need to go to a specialist for that, my opinion.
Yeah, and just know that they're not the same surgery. It's not like you get a rhinoplasty and they automatically address breathing issues. Like, not necessarily.
Yeah,
like they
may not do anything.
Yeah.
Besides straighten the nose, maybe.
Right. Yeah, exactly. So who's a good candidate for this procedure? Healthy enough for surgery. That's key with any surgery. This is one that's specific to rhinoplasty.
Yeah, when your facial growth is complete. And, that's around 16, 17-ish, maybe a little earlier sometimes. So you don't really want to do a rhinoplasty when you're really young. The exception to that may be for people with cleft lip and palates.
But that's more reconstructive.
Yeah, that's congenital problems. But even then, you want to wait as much as you can till their later teenage years. So I was just talking to one of my mentors today who's a craniofacial surgeon. We were talking about that, waiting till 17 or 18 for these craniofacial related rhinoplasties. And those are people, again, with growth problems like Amy talks about, not just cleft lip and palate. There's many different things.
Yeah. You definitely do not want to be a smoker or a vapor. Not good for healing. We talk about that in all of our surgery.
Is there any surgery that you should be a smoker or a vapor?
There is not. It does not exist. Like, it literally does not exist. There's also not one that you should elect to do when you are not healthy enough for surgery. Yeah. Having realistic expectations and a positive outlook and specific goals for rhinoplasty.
This is a big one. Rhinoplasties is one of those red flag surgeries. Amy knows this.
We have a whole slide coming up about that.
Okay.
But you can talk about it now, but we have a fun surprise slide.
So it's the data even shows this, that rhinoplasty has an inordinate amount of people that have really unrealistic expectations about the surgery. And then the quintessential patient is male and they're middle-aged. Yeah. And those patients have really an increase in self-perception issues after the rhinoplasty.
Yeah, being unsatisfied.
Right.
Yep.
So there's ways around that. If you're an ethical practitioner and you do this stuff a lot, that I don't think we don't have that problem. But this is one of those preloaded surgeries that everyone thinks it's hard to imagine what it's going to be like, even with computer imaging. So they build these things into their mind, and it tends to extrapolate out to the face, and all these things are going to be different. And just like any other cosmetic surgery, it's not. It's a subtlety, it's a slight difference, a really wonderful transformation, but it's not like going to be drastically different for your life, especially if you're.
But it can be in a negative way.
Yeah, but in the negative way is where the problem lies. Also, this is a complicated surgery. There's a lot of people that don't do this surgery well. I hate to say that. So there are outcomes that are unwanted, more in this type of surgery than some of the other things that we do.
And they're harder to go back from.
Yeah.
And that's something I didn't put on this slide. Like, a good candidate for a rhinoplasty is, someone who also has not had a rhinoplasty before. One of the things that makes you potentially not a great candidate is if you've had multiple rhinoplasties and are still unhappy with the outcome, more surgery is not necessarily the answer.
Right.
Because of those issues that we were talking about. So
yeah, and every time you go in, you have higher risk of postoperative problems.
Collapse. So, there's just a lot of things. I think that people do understand that. There are definitely examples in social media and in celebrities of people who have had potentially unwanted outcomes in rhinoplasty. So it's understandable how that can become an issue. It's hard to go back from that, even when you have access to, unlimited funds. So if you've gone too far, you've gone too far. A nose that is too large for your face, you're a good candidate.
Yeah.
That's facial harmony.
Too small noses are a lot harder to fix. You have to put grafts in and implants, so that could be a lot harder, actually. And you'll see that in people of African descent or Mediterranean. They have flattened noses, and to build up dorsal bridges or the bridge of your nose and all this kind of stuff is a lot harder than reducing down.
Mm-hmm. Yeah. And then, of course, congenital or acquired asymmetry. So if you have a nose, if you were stuck in the birth canal and had a really wonky nose when you were born and it's still wonky when you're 20, we'd say that's congenital. Acquired might be from having
just do whatever
noses.
Nils did. Boxing with Nils.
Nils' nose looks great.
MMA fighting, whatever Nils does.
The amount of fighting he did. Yeah.
Yeah.
Exactly.
Just hit me on the left side, right? Man, because that's which way it's crooked. Is that what you tell him, Nils?
That's why you're practicing southpaw, so you can get hit on the other side of the face. All right. So who is not a good candidate? This is really important. That's why we brought this up. If you have untreated body dysmorphia, you are not a candidate for really any elective plastic surgery, but especially a rhinoplasty.
Right.
For reasons that have been actually studied. You will lead to not necessarily great outcomes mentally. And having unrealistic expectations of what is possible with surgery.
This is always funny to me. And eyelids hold true. Anything that's small and contained, even though that's very delicate and really interesting, people always extrapolate results to something greater than the area you're treating. You know,
the thigh lift is the quintessential example of this.
Oh, yeah. The thigh lift's going to solve all your lower extremity.
Exactly.
Yeah.
From the tip of your toe to the belly button to the base.
Your calf, your ankles. Yeah. So the nose has this quality to it. But the nose is kind of esoteric. It's not something that people have a hard time wrapping their heads around three-dimensionally, and most people don't think three-dimensionally. I mean, the woman that I love dearest in this world cannot think three-dimensionally. She has to see a picture. And it's maddening because I'll describe things to her and she goes, I have no idea what you're saying right now. So you can't even think three-dimensionally, which is the way my brain works. She's a different
kind of genius, though.
Yeah, I know. She's super smart. But
that's what I mean. Like, just a different way of looking at stuff.
So it's really hard to kind of visualize noses and what that means. And plus, it's, think about it. Like, it looks different in all these different angles, right?
Well, and it's something you can see yourself well.
But not always. You can't. It's hard to see it from the sides. It's hard to see it from different angles.
But you think you can.
Yeah, exactly. So you start extrapolating and making all these things up in your head. And so people come in with crazy ideas about their nose.
Oh, and those pictures that they've taken of themselves in like every different angle and every different lighting on Earth.
And that's like one of the few surgeries like that. Mm-hmm. I mean, even like other facial surgeries do, not as bad. Like but the rhinoplasties have a special place for cray-cray.
Yeah.
And that's okay. I mean, we're not critical of that. We would probably be the same if we didn't like our nose. I told you a story when I was looking in the mirror. I was like, what is going on with that nose? I haven't had that thought before then. So it's okay.
Middle-aged man thoughts.
Yeah, exactly. Why do you got to rub it in? Anyways, so as Amy said, that it's really important from an agency and empowerment standpoint to know that maybe it's okay if you have strong feelings about your nose. Maybe you're not looking at it totally logically or real, kind of on a stable ground.
Or you might be, and surgery is not going to fix it.
Or whatever the case is. It's really just very important to go into offices like ours that do the surgery all the time, that can talk to you compassionately, with understanding, okay, no shame, with grace, and then kind of work through the issues you're seeing.
Yeah. Yep. All right. Let's take a quick break. When we come back, this is perfect time because there's a loud motorcycle driving by. It will be gone.
Yeah, we're going to go jump on it.
And we're back. And now it's time for the slide that I was just talking about. This is the one where we talk about a special note about self-perception and rhinoplasty.
Jennifer Grey. I think she's beautiful before and afterwards, by the way.
AKA the story of Jennifer Grey.
Yeah.
So if you are under the age of probably 35, you probably
Which Amy and I are.
Yeah. You probably
We did a special race. We did Chat GPT. We did research on this.
So you probably don't know who Jennifer Grey is, and that's sad because Jennifer Grey, oh my gosh, I wanted to be Jennifer Grey when I was a younger person.
I was a heterosexual male, and I wanted to be Jennifer Grey.
My middle name is Grey, and I have curly hair like she does, and like I wanted to be baby and be thrown around on a log in a river. Again, you won't get that reference because you weren't born when Dirty Dancing came out, but I'm glad you're here listening to this podcast.
If you're young enough, you probably don't even know Patrick Swayze, which is crazy.
He was in a lot more movies, though. He actually stayed famous.
No, he was like a super famous actor.
Yeah. Whereas Jennifer Grey was an amazingly famous actress who had a rhinoplasty, and it changed her face so much that she really never worked again. And I'm going to read this. So just bear with me while I read this. She had a book that came out a couple of years ago talking about her life, and this was her being interviewed about the 1987 movie Dirty Dancing and how she famously opted for a rhinoplasty after its release at the urging of her own mother. She loves me, loved me, always has. And she was pragmatic because she was saying, guess what? It's too hard to cast you. Make it easier for them. And then I did, and she was right. Grey told the outlet. But after her second nose job, the self-proclaimed anti-rhinoplasty actress found herself at a premiere with Michael Douglas, who didn't even recognize her. That was the first time I had gone out in public, and it became the thing, the idea of being completely invisible from one day to the next. In the world's eyes, I was no longer me. And the weird thing was that thing that I resisted my whole life, and the thing I was so upset with my mother for always telling me I should do, my nose, Grey said. I really thought it was capitulating. I thought it meant surrendering to the enemy camp. I just thought, I'm good enough. I shouldn't have to do this. That's really what I felt. I'm beautiful enough. The Jewish New Yorker's mother told her it would be easier to cast her if she got work done. The Dirty Dancing actress was an anti-rhinoplasty growing up. It's like everywhere I went, I'd be like, wait, excuse me, I'm a person with other features and other amazing characteristics. Why is everyone so hung up on the nose, she added. I'm always shocked at people's meanness. And her nose was, yes, it was a little bit different. And I guess in the 80s, we didn't embrace different. And,
no, I mean, so Eastern European, Ashkenazi, Jewish background.
But this is nothing like Owen Wilson's nose.
No, I understand. But like it's a typical kind of Eastern European nose. And at that time, especially in New York and that surrounding area, all these young Jewish women would get rhinoplasty. It was very common in the zeitgeist of that culture there. So it's really sad that she had that feeling, but still did it anyways. It's kind of devastating.
She really didn't look like herself. Yeah. I mean, I couldn't find the pictures I found is one of her like nowadays. So, but when it was shocking. I mean, even I felt that way when you saw her at this movie premiere. I mean, it really was like, who is that? She
was in arguably two of the bigger movies, Ferris Bueller's Day Off and Dirty Dancing.
That scene where she kicks Rooney in the nose.
I don't even know what the comparison would be now, but like huge movies. So it's pretty sad that she really did not want that.
And she felt peer pressured into doing it, and it backfired.
And the other part of it is that it just is devastating to hear is this idea that ethnic noses in the United States don't look good. So if you have an Eastern European nose or a Middle Eastern nose or Mediterranean or South American, it gets so frustrated with this idea that you have to look more Americanized, which is basically Western European, which is a travesty. You can do a rhinoplasty on someone with an Eastern European nose like her as a young Jewish woman and still hold true to the aspects of that nose and that heritage. It just make it better, but not like completely homogenized.
Yeah.
And that was one of the issues with her, that her nose was changed so much. It didn't really have any characteristics of before.
Yeah. I mean, it did, but it didn't. It was very odd. I just felt so sad reading this, her saying that she felt like she became invisible. And this shows why, if you are already struggling with your appearance and you haven't addressed that first, having a rhinoplasty could really send you into a spiral.
Right.
And this is a person who was famous. And it did to her.
If you look at the data, and this is on our in-service test, they always talk about mental illness and rhinoplasties, and they put those together. And if you come in and you struggle with mental illness, this is data-driven, not like, hey, this is a recommendation, then you really shouldn't offer that person rhinoplasty, because the outcomes can be very problematic in terms of self-perception. It shows worsening of depression, worsening of anxiety, and suicidal ideation from one surgery alone. Mm-hmm. And this is a extreme example, but you can even hear her words in there, understanding that if you suffer from mental illness and then you had the feelings that she was having, that would be pretty devastating too.
I mean, she says, in the world's eyes, I was no longer me. And it's true. I mean, I saw it happen. Like, yes, I felt that way. We all and there was a sense of being like,
is there a happy ending to the story? Because now I'm bummed out.
Well, I mean, she's an amazing person, and she went on to write this book, and you should definitely check it out. So her book came out, I think, in 2022.
Yeah. It's wonderful.
So yes, if you're considering rhinoplasty and you have potentially some really negative thoughts about yourself, you should maybe talk to someone about that in conjunction with seeing a surgeon.
Yeah, therapy. Yeah, work through those feelings first. Yeah. Stabilize your mental health.
Yeah, surgery will always be there. This is elective; it'll always be there. All right, so let's get onto some happier topics and talk about.
Let's get on to the surgery we do all the time. By the way, this is what our podcast is: being honest and truthful with people, and being open, not forcing people to do surgery and co-opting them to doing things so you'll spend money in some office. Yeah. Right? This is about you and your life and the arc. The trail, the path you want to be on.
Yeah. So with that said, there are several types or approaches to rhinoplasty. And this is where I really encourage people, don't get caught up in these words. We're going to say them and we'll talk about them in more detail in our next episode when we talk about surgery itself. But just know that these are words that may be thrown out, especially when you're at your consultation. And they are open or closed, minor or major. Mm-hmm. And then there's also a tip rhinoplasty or an alar. Like we can just do it. We do alar only surgery, which is that weir excision.
Yeah. The nostril areas. Yeah.
Yeah. So don't get caught up on those, but do familiarize yourself with these. And we will talk about what each of them is in our next episode. How do you choose a surgeon?
It's so difficult.
We have an amazing episode, The New Beauty Guide to Choosing Your Surgeon. I highly recommend listening to it. The key reminder is that there is no board of medical specialties that recognizes any board with cosmetic surgery in its name. So you are looking for a board-certified plastic surgeon, a facial plastic surgeon, or an otolaryngologist, which I'm still hoping Nils makes a rap of me saying from that video, because I had to say otolaryngologist about 500 times. And there are boards for each of those. When you listen to that episode, you'll find out how to find a surgeon in each of those specialties. These two, I think, are super important, Dr.
Yeah. So look at results you like. When people come in, we show them rhinoplasty results. We talk about what I see with them, what I envision. We talk about what their goals are. And hopefully it's kismet. Hopefully it kind of lines up with where they want to go. And maybe I'll say something that changes their mind. They're like, oh, yeah, that's right. I didn't think about it that way, or that kind of stuff. So, I think it's really important to find someone with your aesthetic vision. And that's not everyone. Right? Some people love like the West Coast nose, which is like to take everything away and
super tiny button nose,
super small tip and super narrow nose. That's fine. If that's you, great. We support you. That's awesome. That's not me. That's not what I do in my office. But I'm not against you doing what you need to do for your life or finding a surgeon that has that same aesthetic. So that's really important. And we say this all the time, someone that you're comfortable with, right? I don't have the best personality. When you come and meet me, you're like, God, he's a lot. But, Amy has a great personality.
Most of the time.
If you ever met Nils, one of the nicest people I know. But maybe there's something about me that you're comfortable with. Maybe you like my vision. Maybe you like the way I talk. You realize that I'm sincere. I'm talking to you and looking you in the eyes and telling you honest things that I see, honest recommendations that are compassionate and take you into account, not just you physically, but mentally. So maybe that resonates with you, or maybe that doesn't. So you need to find someone that really does, you feel, represent you. And I think that's really important. I know that's a gestalt. I realize that, 3% of 3 out of 100 people are sociopaths. I got that. But in most cases, you can kind of have that reading or feeling when you're in the room with someone and their staff, and the feeling of, do you feel forced to do these surgeries, et cetera, et cetera. So I don't know. How would you describe that, Amy?
You described it well.
Yeah.
I'm going to finish it off there.
But I mean, I know that you get frustrated because I keep on talking, but I don't know how to.
What I'm saying is I have nothing to add.
Oh, okay.
Like, you've covered it. Like, that's how I would describe it. I'm not trying to rush you. I'm just saying, I got nothing to add.
Only you know if you're comfortable.
Yeah.
Right? Like, no one can tell you whether you're comfortable.
Exactly.
You just know whether you're comfortable in a situation. So go with that feeling.
Yes.
This is your face. And you only get one.
That's what I'm saying.
First rhinoplasty.
It's not about angst it's angst that I want to get this across to people. Like, this is such an important surgery for you to find someone that you feel comfortable with.
Yep.
That's where this comes from me more than many other surgeries that we do.
Yeah, because this is a surgery. If you think of your nose like a tent, and we'll talk more about the anatomy of the nose in our next episode, you start messing with that tent and someone throws away, go camping and open your tent up and have one of the spikes missing. And good luck sleeping in that wonky, wavering tent.
With it raining.
Yes.
We've all been in that situation.
Yeah. So
it's dripping through on your face. Well, they came in.
Yeah, right. It's then the fabric of the tent is touching your forehead.
Is that like Colorado metaphor? I don't know. Yeah.
Yeah. Yeah. But my point to that is that you only get one first surgery. So don't group on it. Don't go to the person who's offering you the best deal, perhaps. Go to someone that you feel comfortable with, that you know is going to do you right.
Yep.
So
well said. You said it better.
I said it much succinctly. You said it better.
Yeah.
That's why we work well together. All right. So at your consultation, things you should expect. Full medical history. They're going to talk to you about things about medications, allergies. This is a big one. They're probably going to talk to you about whether or not you breathe and sleep well, because those might be things or signs. If you have trouble sleeping, they might want you to go see someone about your breathing. Supplements, history of smoking, drug use, specifically any drugs that you may have had enter your body through your nose, previous surgeries, any issues you've ever had with your nose. Discuss your options, outcomes, provide a quote. This is where we do talk to you about money. If a doctor quotes you over the phone for this procedure, I'd be wary of that, because this is such a very custom surgery. There is not a set price.
Very bespoke. Mm-hmm. And by the way, so the one yesterday, can I just one caveat?
Yes.
It was the fellow with me, and she gets to rotate with everyone. Really good rhinoplasty surgeons in Denver, and we do a lot of rhinoplasties too. And some people make it very, very complicated. They have great outcomes, and some people make it very easy. I'm always the Goldilocks kind of person. I'm trying to find that middle ground where you just need to do just enough. And it was like blowing her mind. She's like, how can the outcomes be the same, but your rhinoplasty only took an hour and 45 minutes and this one took 4 hours?
Oh my goodness, 4 hours.
I know. I was like, because paths can end at the same place.
Yeah. Yes.
And that's true with surgery.
This is where you need some quote about the winding road.
Yeah, exactly.
You need a Google Maps for rhinoplasty.
Yeah.
You're right.
This is the 4-hour route. This is
That's
the
right.
2-hour
Like,
route.
avoid tolls. Oh, it's going to take you 4 hours.
But time in the OR costs money, and procedural stuff, if you do more things, that usually get charged for it. So, my feeling about it is global pricing for rhinoplasties is fine, but one rhinoplasty is not equal to the other, not like a breast augmentation.
No, I mean, as those words that we had on the previous slide, a closed minor tip rhinoplasty versus a complex open major rhinoplasty
With cartilage grafts.
Yeah. What if you have to take rib cartilage? You can't just get enough from the ear. I mean, these are drastically different procedures.
Yep.
So you'll get a quote at your consultation with most doctors. Review the risks and potential complications, look at before and after pictures of similar expected outcomes. And this is really key, finding pictures that, you might not find somebody who looks just like you, but in your same age group perhaps, or with similar skin tone to you. Those are things that are going to be more meaningful than just looking at just hundreds of random pre and post-op pictures, and answer your questions. What are some good questions to ask your surgeon?
Are you board certified? By the way, I am. And I have to take my recertification update test.
Yeah.
And so it
in
never
4
stops.
years, you have to do your whole recertification
It
again.
never stops. It never stops for me. Am I a good candidate for this procedure? I think it's a really, really good question for any surgery you're doing, but especially this. Because they may say, oh, yeah, I would do this or that, or I could do this or that. I mean, there's always potential to do things, but they may say, yeah, you know what? It's not worth it. Like, you're not really a good candidate. Mm-hmm. Or they may, after talking to you, realize that that you might not be a good candidate because your expectations aren't within line with what they can do.
Or you're a current smoker.
What about this one, Amy? The next one.
What surgical technique is recommended for me?
Right. Mm-hmm. This is where the wheels fall off, right? In reality, the surgical technique you need is the one you need.
Yeah.
I love educated, informed patients, but rhinoplasties are so in the weeds and so nuanced that it's probably not even worth it trying to get down into exactly what's going on until you see someone for a consult.
Well, that's why it's good to know those basic terms, because those are the things that are like, okay, these are the meaningful things to me. Is it going to be open or closed? That's a meaningful thing. Is it all the other internal stuff? No.
In part 2, we will teach you the surgery.
Yes.
So it's worth watching.
Oh, yeah.
It will be worth your time if you're serious about a rhinoplasty.
Yes. Risk and complications with a rhinoplasty. How are complications handled? And what can I expect, or how can I expect my nose to look or age over time? This is especially important if you are having this procedure as, anyway, 17 to probably 30, because while your facial structure is in place, your face is going to change a lot after that age over the course of your lifetime. So
in some ways, your rhinoplasty may not change a lot, but your face would change, and then you don't really like the match at that point.
Yeah, that's that facial harmony.
I've seen that. That's usually like the revisions at 40s and 50s.
Yeah, like a little touch up here or there. You might need a lip lift. We have a great episode on that. So just things that can, affect the area around your nose might be more the issue than your nose itself at some point. So all right, Dr. Martin, I think we covered part 1 well.
We did such a good job.
In part 2, we have a deep dive on the anatomy, which you guys know from my previous episode about nerves and the magic school bus that I really love talking about anatomy. We're also going to talk about the surgery itself and everything you need to know to recover, pre and post-op, all that good stuff. Dr. Martin, you got anything to add?
Yeah, I just can't wait for the next episode. Is it like next, or do we have to wait 2 weeks?
We have to wait 2 weeks. It'll be out July 1st. And actually, it's perfect timing because a lot of people, we talked about doing this rhinoplasty surgery in your, late teens.
Right after school's over, you could celebrate the birth of America and get your rhinoplasty before college.
Well, no, it's more that at this point, you're going to do it over your Christmas break because it is already July 1st.
We're too busy. We're too booked out.
Well, and if you're listening to this now, it's July 1st. Enjoy the rest of your summer, not bruised, or do it in September right before, give yourself like 2-3 weeks before you start class. But it's a great surgery to do in the winter because you can kind of hide out. You can't ski, but you can come home, do your rhinoplasty, have a couple of weeks of just chill time at home with your family, and then go back to school. And then for summer, you're good to go.
Yeah.
So that's how I would time it.
That's a good point.
You are listening to this at perfect timing. Right. And I'm sorry for the things I said about you all being young and born.
You're not.
After Dirty Dancing came out. But it's true.
By the way, it is nature. Dirty Dancing is kind of a disturbing movie. It's like a 30-something-year-old guy with a 17-year-old.
I mean, it's kind of like a Disney movie in that sense.
There's nothing Disney about that.
No, but that all the Disney princesses
and
were
also
16.
there's a woman. There's a teenager pregnant.
She's not a teenager.
Whatever. There's a lot of problems in that movie.
But they take care
Ferris
of them.
Bueller's maybe less so. But anyways.
Ferris Bueller. I mean, if you want to just do me, and Rooney, I mean, he gets his nose broken, so he needs to listen to this movie too. He gets kicked in the face by Jennifer Grey. Rooney. Yeah, and gets gummy bears thrown at him on the bus. All right. Yeah. As typical, if you've made it this far in the episode, you have caught this gem along with all the others that happened in like the last 2 minutes of the episode. Okay. Really appreciate everyone watching. Please do tune in 2 weeks to listen to part 2 because it will give you more of the meat of the surgery and the actual like stuff you probably really want to know about other than statistics. Social media handles are here yet again. Please leave me a voicemail, shoot me a text, 303-630-9038. Numbers are hard. And we will see you all next time.
You were trying to put the 9038 first.
Yes, I was.
Okay. See you later.